Hi, good afternoon. My name is Anjana Babu. I'm doing a fellowship in the Indian Academy Optometry in awards as a practical section for the vision therapy. Let me talk about the vision therapy. Vision therapy is the important main role for the pediatric life. Why? Because they are introducing for the new visual comfort. So they are playing very important role for their life. So we have enhancing for the different activities, different skills, different moving to improvisation, to enhancing, to accumulating for their vision comfortable and vision stability. So different categorization program to developing this vision therapy. First one we can introducing for the pencil push-up test or converge insufficiency test. Firstly, they have introducing for this for the pediatric life, so adult life, then downwards of the human of any age category is using for different accommodative stimulation for the our eyes also. So they have no age limitation for also, but mainly use to easily use for this method. So they can be introducing one pen or pencil, but they mainly important we listening for that have their symbolizing like number, different shape, different color, different category. For the pencil or pen they mustly included. So I just demonstration for that also. I have available now this pen. It's a normal pen, but you mustly listen, you remembering for that this pen have their symbolizing a different color, different shape, is everything. Anyone you if you available, okay. Why? Because this is a main important role for the symbolization. Why? Because we can moving this pen or pencil, the accommodating stimulus for the eye for the variety colors and variety shape for the easily catch up. Otherwise, the accommodative stimulation will be lesser as normal. Okay, so we can doing for the 1 arm distance. Actually 1 arm distance we had will be normal posture, and this pen or pen without available we can doing further in front of our like nose distance. For the nose distance arm, for we are moving for the inside and backward, in front forward and backward doing. Just I am demonstration for actually like this doing for the 1 arm distance, 1 arm distance. For this one we can stimulation for the accommodating eye. That means you repeatedly doing this exercise for every after 3 minutes in 5 times, 6 times, 7 times when you free get it. That wise accommodative stimulation will be relief and variation. This is the best easy method for the pediatric. Then the next second one is the occlusion therapy or the pediatric patching method. This is also playing important role for that. For everyone is not available for that method, but it's to become easy. Like we say patching, if the patcher will be not getting to available, we can using for the tissue also. The tissue will be maintained for 3, 4, 5 layers. They are patching one their allowed. Is I am telling for the easy method. It's not accurate, but we can using like this also. As occludant patcher is available in medical shops, in their optical shops and other supermarkets also easily available also. But if we don't get this also using for that. So I am telling like that. Like we can they have a occlusion method for as easy for then also more beneficial also. Like they have 4 types. First convergent, is consufficient, is inverse, then part-time, full-time, total and partial. What I am detail telling one thing also, conversional. Conversional means when our eye will be amblyopic or for the laziness. Laziness means our eye is not working properly, but they have a working, but it's the accumulated laziness of our nerve and eye that become laziness of eye. That eye is will be working is the our preventional status. So the conversion also using the working eye getting to occlude or patching. Okay, so the laziness eye getting the more working chances to enhancing. With example like building set, drawing, different games also. So the patching for the amblyopic eye to working for the other patching is the normal eye and amblyopic eye will be working as a possible. Next is inversal, the opposite of the conversional, to occlude for the amblyopic eye working for the normal eye. So the eccentric fixation will be, everything is highly increased. Next one is the total and partial. Total and partial means they have a total means non-nystagmus eye for the children. Why? Because the light will be in our entirely directly, so they have highly intensity of light, in highly intensity of the accumulation for our eye also. So total use for the non-nystagmus patient for the children, other is a partial using for the nystagmus patients. Then also full time and part time. Full time means non-strabismic amblyopic children. Why? Because the strabismus eccentric and eccentric fixation will be varying for these children. So non-strabismus amblyopic eye using for the full time, part time occlusion or patching method using for the strabismus children. Then next one is the synaptophore. Synaptophore actually is available for the hospitalization or clinical. Okay, this other name is amblyoscope. This principle working on the haploscope. Haploscope means the underlying basing of the different categorization togetherly blend. So the synaptophore using for the therapeutic and the diagnostic method for using, then also different BSV grade also we can identify for the synaptophore. So we can patient or children were looking for the putting the chin for the rest and putting looking for the eyepiece. They have a different shape and different image putting togetherly for their inside. Then the light will be on, their light will be reflected for their plus 6.50 diopter for the lens. They are reflecting to the mirror and getting the image togetherly to blend. Then also they are in getting for the BSV grade, convergence, divergence is everything to be getting from the synaptophore. This is important role for this pediatric section for the vision therapy. It's a most playing for. Why? Because the increasing of the intensity, accumulations, everything will be increasing for this getting. Then the prism. Prism also is one of the main for the vision therapy. Why? Because vision can be using for the contact lens, lens with the frame. They can using for recognition for the vision therapy using for the children. So putting the vertical prism for using for the vertical exophoria, exotropia, then also divergent insufficiency we can also accommodation for the pediatric section we can calculate also. Then we can introducing now once the pencil push-up test, patching or occlusion, the prism, synaptophore we can introduce. The patching also we can easily accumulate it, but as using for the contact lens and spectacle. But contact lens is a most risky factor, you know, that as well as their cleaning methods and they are mainly for the keeping for this eye is mainly hygienic is important. So the children as well as a non same properly feel like that, so become to allergic conjunctivitis is something to the diseases related to come, but the spectacle is more preferable to the patching. So now what we can available more trendable more easily for the computer software. Why? Because in our monitor Mac for they are using for inside house, outside house, you can doing with your hand also. So the software is using for saccadic and pursuit movement also we can available for the computer software. So now onwards trendable also. Next one's home vision therapy. Home vision therapy, that means they have you using from saccadic movement as a main thing. Then they have a PVT, a professional vision tracking. That means 5 main things are including like moving target, fixing target, moving light, moving objects is a saccadic target also. Everything included we can using for the vision therapy is the main thing for the children to improvisation for the visual comfort. So this are I am now introducing for you. I better to know you for. Hope you will. Thank you.